Which nerve innervates this muscle? Gabby here from bootcamp.com, and in this dissection here, we're looking at a lateral view of the right aspect of the neck. So here's the neck right over here. To identify some structures in the neck, we can see the common carotid artery and the internal jugular vein traveling together. Here we can see the submandibular gland. As we travel more superiorly and more laterally, here we're going to be able to find portions of the auricle or of the ear, of the external ear. And here's where we're going to be able to find the chin. So that being said, we have superior here, and then we have inferior here. So the thorax will be found down below. So the neck is a super important conduit for a ton of vessels, nerves, and even attachment points for muscles that allow for neck movements, scapular movements, even movements around the aspects of the floor of the mouth. There's also some muscles that act on the hyoid bone to assist with swallowing. Now, the hyoid bone can't be seen very well here because there are a ton of muscles attaching to it, but it would be located approximately in this region. So all of these muscles that you're seeing below it, so all of these guys are going to go ahead to attach onto the hyoid bone. So because all of these muscles are found inferior to the hyoid bone, they are referred to as our infrahyoid muscles, also known as our strap muscles. We have muscles that are found superior to the hyoid bone. This includes our tag muscle, as well as the geniohyoid and the mylohyoid. Those are considered our suprahyoid muscles. Now, for this particular muscle, we see two muscle bellies. We see one on the more anterior aspect, and then we see another that travels more posteriorly. So as our location suggests, we have an anterior belly and a posterior belly. And these bellies are connected in the middle via an intermediate tendon. So do you remember the name of this muscle? This muscle is going to be the digastric muscle. So we have the anterior belly of the digastric muscle and the posterior belly of the digastric muscle. This anterior belly is going to originate along the aspects of the mandible, more specifically on the digastric fossa of the lower portions of the mandible, and then we'll go ahead to insert on that intermediate tendon. The posterior belly, however, will originate a bit further. We can't actually follow it all the way to its origin point, but it will originate along the mastoid notch of the temporal bone and then eventually insert onto that intermediate tendon. So we have this muscle that is able to contract in this direction, and the posterior belly is able to contract in that direction. So these two muscle bellies will act together and are primarily responsible for depressing the mandible, as well as elevating the hyoid bone during swallowing or chewing. Now, the weird thing about these two bellies is that they actually originate from different embryological origins. The anterior belly of the digastric is actually derived from the first pharyngeal arch, so it receives innervation from the nerve to mylohyoid. We could also see the mylohyoid muscle right here as well. The posterior belly, however, is derived from the mesoderm of the second pharyngeal arch, so it receives innervation from the digastric branch of the facial nerve. So in terms of our question here, so which nerve innervates the anterior belly of the digastric muscle? The answer to this question should be nerve to mylohyoid.